Hi, my name is Morgane Barratt, and today my partners, Adrienne, Emick, and I, as well as Saffron and Snethen, will be diving into the depths of health clinics in Kenya. We are doing our projects on the effects of malnutrition in pregnancies in Kenya. Kenya is a very impoverished state in East Africa, which has a population of 43.5 million people. The country is a young population, with 73% of residents aged below the age of 30, because of rapid population growth, from 2.9 million to 40 million inhabitants over the last century. Our project focuses on how the lack of prenatal care, specifically malnutrition, affects mothers and their babies. Nurses treat 80% of the population who visit dispensaries, health centers, and private clinics in rural and underserved urban areas. The infant mortality rate is high, at approximately 44 deaths per 1,000 children. It is estimated that in 2011, only 42% of births were attended by a skilled health professional. Research shows that many Kenyan women are afraid to get prenatal care for fear of being stigmatized as AIDS patients. If women test positive for AIDS/HIV, they risk being kicked out by their husbands and judged by their neighbors. This fear keeps women away from clinics during their pregnancies and even when they give birth. Other studies show that once these babies are born, underweight, and admitted to Kenya's leading public hospital, they are at a higher risk of dying within the first month than they were 25 years ago. 16.5% of children under the age of 5 in Kenya are underweight compared to the U.S.'s 1.3%. Prenatal care in Kenya is very limited due to the expensive vitamins, shots, and other precautionary treatments for pregnant women. An average Kenyan woman does not acquire the funds necessary to even have a regular checkup. Another issue is the convenience of doctors. Many hospitals are very far away. The result of poor health during pregnancy is underweight, undernutrition babies. A mother who does not get any form of prenatal care is 3 times more likely to have a low birth weight and 5 times more likely to die than a mother who receives prenatal care. Some other factors to contribute to underweight babies are smoking, stress, caffeine, coffee consumption, alcohol, race, and having a low maternal weight at your own birth. Women should maintain a healthy weight, diet, hygiene, and a proper amount of sleep, as well as regular checkups to receive ultrasounds to discover current or possible future problems. Prenatal care is vital to a woman and her baby's health because it can help prevent not only premature birth, but also dystocia and toxemia. Malnutrition contributes to more than 1/3 of child's death in poor countries and increases their chances of stunted growth and severe illness. Lack of nutrition from the mother at birth has a direct impact on their babies. Feeding behaviors, access to nutrients, and better nutrition policies must be put in place in Kenya in order to support pregnant women. An estimated 342,000 women die each year during either pregnancy, childbirth, or the 6 weeks following. Although the global rate of maternal deaths has fallen, the mortality rate in Africa stays at an all-time high. Excessive bleeding and maternal infections are 2 of the highest causes of death. Over half of Kenya's population is under 25 years old, and HIV infections continue to rise. Reproductive health programs need to be strengthened, specifically the advancement of safe labor for mothers. Postpartum hemorrhage after childbirth is the greatest cause of maternal mortality. Kenya needs better birth attendance and more supportive policies for third-stage labor, which is proven to prevent cases of postpartum hemorrhaging. Teaching families about the importance of skilled care during pregnancy and birth is also a good approach. The foundation for a long and healthy life is proper nutrition from a young age. This is a problem in Kenya because proper nutrition isn't within reach for a majority of babies and their mothers. When it comes to energy and nutrients, the first 2 years of your life are vital in receiving them. Without proper nutrition, children suffer devastating consequences such as illnesses, stunted physical and mental growth, and even death. If there is not proper nutrition and healthy prenatal care, a major illness that newborns and children suffer from is severe diarrhea. When children have diarrhea at an early age, it causes harsh malnutrition and also stunts their growth. Malnutrition causes kids' growth systems to move slower, so their bodies develop at a slower pace than regular, healthy children. Since their bodies are developing slower, their capability to learn and their emotional development are too. Diarrhea is the 3rd leading cause of death in children under the age of 5 in Kenya. There are many programs that are working to better the health of children in Kenya, including an organization our mentor, Courtney Weiland, works for named PATH. PATH is an international non-profit organization that transforms global health through innovation. They develop and deliver high-impact, low-cost solutions, from life-saving vaccines and devices to collaborative programs with communities. They work in over 70 countries, finding solutions for emerging epidemic diseases like AIDS, tuberculosis, or malaria. They create health technologies designed for low-resource settings They fight for health equity for women. They help with basic protection of vaccines for women and children around the world. To gain more information on the difficulties surrounding malnutrition in Kenya, we talked to some Kenyan students from Seavuria. The following is a clip our group sent them.
Hi, I'm Saffron.
I'm Adrienne.
I'm Morgane.
And we are from Mr. Cook's Research and Ethics class from Mercer Island High School, and we're participating in the Bio Expo, which is a science fair.
We are a part of a Seavuria research program, and our main focus for our research is prenatal care and nutrition in Kenya.
We are working with our mentor, Courtney, who works at PATH, which is working on new ways to distribute vaccines.
We have done research regarding prenatal care, and we have found that nutrition such as pills and vaccines are not evident, which leads to underweight babies.
We also want to educate women about precautions to take during birth, such as no smoking, drinking, or drugs.
We have a few questions. 1. Is our research accurate? 2. Are you aware of the precautions? 3. Do women receive medication of any sort or prenatal care / checkups?
See you next time!
Bye! They did in fact respond to our questions through email. Their response went as follows. After watching the video, we have the following to say. Your research is accurate. There is prenatal care to mothers, though due to ignorance, poverty, and distance from health facilities, some do not attend the clinics. During such visits, the mothers are examined, especially on body weight, HB level, and physical signs of disease, then advised on what to take. If the signs of malnutrition are severe, they are given some food to help the mother prevent it. Women receive prenatal checkups after every 2 months for public health facilities. For those who are endowed with resources, they visit private doctors where they're given more frequently. For those that attend public health facilities, mothers are given compulsory anti-malaria drugs, vaccinated against tetanus, iron supplement tablets in case one's HB level is low, and lastly, vitamin A. Mothers are also tested for sexually transmitted diseases and treated. HIV is also a must. The response we received from our Kenyan students reinstated the fact that our research was in fact accurate, and Kenya still has a long way to go down the road to medical recovery, especially with prenatal care. We hope you enjoyed our video, and we know that through programs such as PATH, medicine in Kenya will continue to improve.